Hi, my name is Rose Wortman, and I will be talking about anxiety and exercise. What are anxiety disorders? Anxiety is a normal reaction to everyday stresses, such as financial, school, competition, speeches, anything in life that may cause stress. Anxiety disorders are characterized by long-lasting anxiety symptoms that sustain or worsen over time. The American Psychiatric Association characterizes anxiety disorders by the following. 1, that anxiety that is out of proportion for the situation or age of the individual, and 2, anxiety that is preventative of normal functioning. Types of anxiety disorders include the following: general anxiety disorder, social anxiety disorder, panic disorder, agoraphobia, separation anxiety disorder, specific phobias, post-traumatic stress disorder or PTSD, obsessive-compulsive disorder, OCD, and among others. The prevalence of anxiety. Anxiety is the most common mental health illness, and it currently affects about 18% of the U.S. population. Prevalence of anxiety in our population costs U.S. about $42 billion a year, and will affect about 30% of individuals at some point in their lifetime. Women are affected by anxiety disorders twice as much as men. Prevalence of specific anxiety disorders are the following. So, general anxiety disorder affects about 3.1% of the U.S. population. Social anxiety about 6.8%. Panic disorder about 2.7%. Specific phobias affect the most of the population. That's 8.7%. OCD about 1.1%, and then PTSD about 3.5%. The graphic to the right goes hand in hand with what we said about 1/3 of those being affected by anxiety will actually seek treatment. So we see only about 33% of patients diagnosed with anxiety disorder have actually received counseling. That means 67% of those with anxiety are not treated at all. Of those 33%, 25% are counseled by a primary care team only, and then 8% are counseled by mental health professionals. Risk factors for anxiety depend partly on what the anxiety disorder is, but according to the University of Maryland Medical Center, the following are risk factors. First one being gender. Women are twice as likely as men to be affected by anxiety, and the exception is with the OCD. Age is a second risk factor. OCD, separation anxiety, and phobias usually appear in early childhood. Then social phobia and panic disorder usually appear in an individual's teen years. Third risk factor is traumatic events, and that's the cause of PTSD specifically. Medical conditions are another risk factor. Although research has not scientifically proven the reason for the relationship between the two, certain medications have been associated with anxiety disorders. Some of the conditions associated with anxiety disorders include obstructive sleep apnea, mitral valve prolapse, irritable bowel syndrome, among others. Personality factors are a risk factor. Children that are shy, are worriers, or have a history of being bullied are at a higher risk for anxiety disorders later on in life. Family history and dynamics. Genetics may play a role, but family environment and psychological influences can affect an individual's level of anxiety. And finally, social factors. Anxiety can be related to a lack of social connections, isolation, or an unsafe environment. Causes of anxiety. First one being genetics. 50% of those with panic disorder and 40% of those with GAD have a close relative diagnosed with anxiety disorder. Biochemical factors are a cause of anxiety under research. So they've shown that the imbalances of neurotransmitters in the brain are linked to anxiety disorders. Potential neurotransmitters include GABA, serotonin, dopamine, and epinephrine. Brain structure is another cause under research. Anxiety disorders are linked to oversensitivity of the amygdala, which is the fear center of the brain, which regulates emotion, fear, and memories. Signs and symptoms of anxiety depend partly on what the anxiety is, type of anxiety disorder is, and the following are actually physical and emotional symptoms for general anxiety disorder, but can be applied to all the anxiety disorders. They include irritability, restlessness, feeling on edge, difficulty concentrating, tense muscles or muscle spasms, difficulty sleeping, constant worry or apprehension, increased heart rate or blood pressure, excessive sweating, shortness of breath or difficulty breathing, dizziness or lightheaded, butterflies in the stomach, and then tightness in the chest and throat. Management of anxiety, we'll talk about 4 main ways today. First one being cognitive behavior therapy, which is a type of talk therapy to enable an individual to think, react, and behave differently when dealing with anxiety. It's an individual to identify and then subside unwanted thoughts. So CBT focuses on the relationship between thought, behavior, and emotion. Thought being what we think affecting how we act and feel, behavior being what we do affecting how we think and feel, and then emotion being what we feel affecting what we think and do. Another way to manage anxiety is through friend or family support groups. It gives an individual support and comfort to manage or overcome their anxiety, allows an individual to talk their problems out. Medication is the last resort for management of anxiety. It's not able to cure anxiety, but can help relieve symptoms. So it's most commonly used for individuals first being treated for anxiety or not responding to therapy. It has to be prescribed by a medical professional. The most common medications, the first one being antidepressants, used to treat both depression and anxiety. Anti-anxiety medications help reduce symptoms of anxiety, panic, or worry, and the most common ones are the benzodiazepines. Beta blockers are another medication used, and they help control symptoms of anxiety such as the rapid heartbeat, shaking, and trembling. Then finally, to manage anxiety, a big component that's coming out is exercise. Exercise and anxiety. Physical benefits of exercise are obvious, but the mental or intellectual benefits are often overlooked. Exercise has been proven to increase cognitive function and concentration, and then reduce stress and anxiety. Research shows that exercise can improve mood, improve an individual's quality of sleep, and improve self-efficacy or self-esteem, which can all alleviate or lower anxiety. Physically active individuals have lower incidences of anxiety than sedentary ones. Study actually showed that sedentary individuals were at a 25% higher risk of developing an anxiety or depression disorder within the next 5 years than individuals who partook in regular vigorous activity. Research and studies are showing that exercise induces change in the APA axis, which can improve reactivity to stress and anxiety. HPA axis is in communication with the brain's limbic system, which controls motivation and mood, the amygdala, which controls fear and response to stress, and the hippocampus, which controls memory formation, mood, and motivation. To the right, we see a graphic of the HPA axis, the relationship between the hypothalamus, pituitary, and adrenal cortex. The effect of anxiety in the exercise response. There's actually no contraindications for anxiety patients in order to participate in exercise unless there's present comorbid conditions. Anxiety disorders need not change or alter the physiological responses to exercise. Certain medications, however, may affect the exercise response, and this information should be gathered prior to exercise testing or prescription, and special considerations should be made. Following is a case study. So the name of the patient is Gina. She's a female. And the following are CBD risk factors for her. For age, she's age 58. She has no family history of CBD or CAD. She is a cigarette smoker and she's physically inactive. She is not obese. She has a BMI of 22, which is a normal range. She's no hypertension. Her blood pressure was 112/74. Dyslipidemia, she does not have that. She has LDL levels of 132 milligrams per deciliter, and then HDL levels of 65 milligrams per deciliter. And she has no diabetes. So she has 3 positive risk factors, that being her age, her cigarette smoking, and then her physical inactivity. But she also has 1 negative risk factor, That's the HDLs, so she technically has 2 positive risk factors. As a result, she has no history of CAD or CVD. As a medical history, she actually had Graves' disease, so her thyroid was removed. The disease is under control, and she takes Levoxyl as a hormone replacement. And then our big concern is that this patient has general anxiety disorder, and she came for an exercise regimen to subside those anxiety symptoms. Her exercise history: 3 months ago, she actually stopped her regular exercise regimen. She was walking 7 times per week for 30 minutes per each day, but she stopped. And then her goals are to subside anxiety symptoms, find activities she enjoys, but she's able to do daily. She must have been getting bored with whatever activities she was doing. Special considerations: comorbid conditions must be considered when considering exercise tests and prescriptions. If an individual is high functioning without comorbid conditions, you follow the ACSM recommendations. And if they're low functioning due to comorbid conditions, you follow the basic CDD-4 recommendations. Gina's high functioning, so she can follow the ACSM recommendations. She did have Graves' disease, but her metabolic disorder is under control. We have to be aware of how the patient is feeling each day. We have to be encouraging and serve as a line of support. They're coming to do exercise to subside the anxiety. You should always consider the environment and what triggers the patient's anxiety. For example, a group fitness class for a patient with social anxiety disorder will be no benefit, and a main trigger is stress and anxiety. Gina has generalized anxiety disorder, so asking more about the triggers of her anxiety could help to make special recommendations for her exercise program. For exercise testing, we're going to use the ACSM pre-participation screening algorithm. She is not participating in regular exercise and has no metabolic disease, but is asymptomatic. So medical clearance is going to be recommended before participating in light to moderate intensity activity. Once she's cleared, she should start with light to moderate intensity activity and then progress to more vigorous activity using the ACSM guidelines. For testing, I would use a cardiovascular fitness test, the modified submaximal Bruce treadmill protocol, because she is sedentary. Then for muscular fitness tests, I would do a modified max push-up test to test her muscular endurance, and then a 1RM squat test to test their muscular strength. For exercise prescription, she would be following the basic ACSM recommendations: 150 minutes of moderate intensity exercise per week. You can do that 5 days per week in 30 to 60 minute sessions. You can break those down into as little multiple bouts of 10 minutes. The intensity she should be targeting is 40 to 60% of her heart rate reserve, but she may start a little lower depending on how deconditioned she may be. We should find enjoyable activities for her because she is doing this exercise to subside her anxiety and she wants more variety. So we could include swimming, biking, elliptical, or Zumba. For resistance exercise, we're going to do 2 to 4 sets of 8 to 12 reps, 2 to 3 minutes rest between sets with an intensity of 60 to 80% over 1RM. She did this 2 to 3 days per week per muscle group, and then allow 48 hours of rest between the sessions for each major muscle group. We might have to start lighter intensity because she's deconditioned, so we might do 1 set of 10 to 15 reps at 40 to 50% over 1RM. For flexibility, we do 2 to 3 days per week, holding each stretch a total of 60 seconds. That can be performed in multiple bouts. We should perform static stretching after the workout. This can increase range of motion, but also relax the CNS and subside some anxiety. They may also perform dynamic or PNF stretching techniques. Other recommendations, we could do yoga or Pilates 2 to 3 times per week, which has been proven to reduce anxiety through breathing techniques and mindfulness. As a conclusion, the rising prevalence of anxiety in our society is concerning. Mental health is a growing area of research, and exercise should not be overlooked as the first line of treatment for anxiety disorder. It's important that patients are aware that they are not alone. Help is out there for everyone. Thank you for watching.